to the Inspired Hygiene Podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Welcome back, everyone, to the Inspired Hygiene Podcast. We talked all about the number one most common missing opportunity in hygiene, and that really is identifying and treating periodontal disease. And as I mentioned in the episode before, a lot of times folks think, gosh, what's the next thing that's going to help our hygiene department become profitable? Is it adding laser? Is it adding an adjunct? Is what, typically it's some type of technology or product. And what I've found is that very often when teams grasp at something like that, they're not as successful in implementing it as they hope that they can be, because they don't have the foundational diagnosis protocols in place. They don't have that. And what that trickles back to is they don't have a clear written standard of care. So in today's episode, we're going to talk about some of the mindset shifts that must happen in order for teams to go from a low perio awareness, low perio percentage, to really having this be a robust part of the hygiene department and the practice as a whole. What do those mindset shifts look like? And how do they support themselves by having a written standard of care that the whole team can get behind? So let's dig into that today. So at Inspired Hygiene, yes, we get dentists, practice owners calling us all the time. And a lot of times team members would think that they call us and say, how do I get more production out of my hygiene department? And I will tell you that is very rarely what they lead with. What they lead with more often when they call us and they're asking for help is consistency and clear protocols for clinical care. And most practice owners know that if they get those two things in place, that the production will come, because when we have clear systems for diagnosing and presenting treatment and completing that treatment, that all of those things those procedures are more productive and they're more impactful for the patients than the routine adult prophy, the routine hygiene preventive appointment. And I say routine not to minimize the importance of that, because there are critical screenings that happen even in a preventive hygiene visit, but it's the thing that we do most often, right? And so when we add other procedures into our service mix, then it just creates more productivity and profitability for the hygiene department. But that is not what most dental practice owners lead with when they call us. They're really looking for help. They're looking for an outside eye. Many times they've tried things. Many times the doctors have said, hey, I've talked to my hygiene team about, doing more perio diagnosis. We've reviewed this. We've looked at x-rays. And for some reason, it's just not sticking. And there are a lot of factors. We talked about that in the previous episode, what some of those obstacles are that block the progress of a perio program. So I would ask you to go back and listen to that and really think about that in your practice. But what I would say that we start with is not production. It is the why. Why even put the effort into getting out of your comfort zone, disrupting your current workflow to create and implement a consistent and comprehensive periodontal diagnosis and treatment system? Why is that even worth your time, your energy, and the work that it takes to create that? And I would say really the why in my mind, and what we find really resonates with hygienists and dentists and business team members and assistants all over the country, is because inflammation impacts so many other parts of our body and our well-being. And the reason why is because dental team members want to They want to get back to the purpose of why they went into dentistry to begin with. And that is to be an integral part of our patient's healthcare team, to be true healthcare practitioners, to provide the very best that they can, to their very best to their ability in oral care and in really oral health care, because oral health is health. Our oral health contributes to our overall health. And every year we're seeing significant research that is confirming that. So that is my why, is to help dental teams recognize the power that they have and the impact that they can create if they will take the blinders of the prophy off and really look at what is happening with these patients and how can we make an impact in them by recommending the treatment that is in their best interest. So that is the why. I will tell you that in our coaching programs, in our Perio Protocol online bootcamp, we go into that extensively, like looking at the references and the research on, yes, there actually is a connection between periodontal disease and increased risk for heart attack, stroke, type 2 diabetes. You have patients in your practice every single day that have diabetes and that are doing their best to control it because they know that it affects their longevity. It affects their long-term health. It affects everything in their life. And you, in turn, by identifying if they have periodontal disease and helping them eliminate that infection, you're impacting everything in their life. So that is the why. And the why is really an effort to create that conviction really within the dental team of, I can't not tell my patients if they have inflammation, if they have gingivitis, if they have periodontal disease, if they have active decay, if they have periapical infection. Like, periodontal disease is not the only oral condition that impacts overall health, right? There's been research as well linking periapical symptomatic and asymptomatic periapical lesions to increased risk of heart disease. And so it is our obligation. Remember, now this is a long time for me. So I graduated from dental hygiene school in 1991. That is so long ago. It is crazy that in 2026, that will be my 35th year of being a dental hygienist. It is nuts. It has gone by so fast in some regards and so slow, right? On some days, we can all relate to that. But I say that because look back at what we promised to do, and if you're a dentist, you took a very similar oath. We promised to continually up-level our skills to provide the best care possible. And I'm going to give you a little tough love here, that if we are not paying attention to our patient's inflammation and identifying and diagnosing with them with active periodontal disease, and if we are not seeking ways to help them understand the importance of that disease and presenting treatment, we are neglecting and we are not fulfilling our agreed upon obligation as clinical dental health providers and practitioners. So do you want it? Is that what you want for yourself in your current state of your career? Or do you want to step into this role as healthcare practitioner? Because that is there for you. The door is wide open for you, and there's no better time to do it than right now. Now, is that going to take doing things differently in your day-to-day practice? 100%. Leaders, is that going to mean leading your team and holding them accountable to these standards of care? 100%. Is it going to mean having some conversations with your patients that are different than the conversations that you've had in the past? Yep, it is. But it's worth it because you could actually have a huge impact on your patient's overall health. I'll give you a quick story. This has been, probably a decade or more ago. I was in clinical practice and I saw a patient. She was a young patient. She was 26 years old. And I live in Charlotte. We're in a fairly affluent area where I was practicing in Charlotte at that time. And still, we saw patients, and you see them too. It just depends on how you're defining periodontal disease. You see them too that are 30 years and younger that have well-established periodontal disease. And she was one of them. She had bone loss, she had bleeding, she had pocket depths that were 4 or 5 millimeter pockets, and she also had lupus. Lupus is an autoimmune inflammatory condition. And I knew that it was very important for this disease to be treated and to stop this inflammation. So she went through active periodontal therapy, and she came back for her first perio maintenance after therapy. And I said, well, how, we did our complete assessment. I showed her, I was like, look at this. You had 28 sites of bleeding and now you have 2. You have had an incredible result, and congratulations on making this investment in yourself. And she said, I, I feel so much better. And she said, you're never going to believe this, but I have been able to go off all of my pain medications that I was taking as a result of the inflammation, the pain I was having from the lupus. And it blew me away. I will never forget that. And, I don't know that the periodontal treatment was directly, responsible for her being able to go off her pain medications. I can't say that. But what I will tell you is that you cannot discount the anecdotal evidence that you see in your practice every day. You can't discount that experience of that patient. You've got to share that. Share it with your team. Share it with other patients. This is what happened. I don't know how directly it was related, but this is what happened with this patient. Because here's the thing, it will take decades for the clinical research in a university in, Chapel Hill, North Carolina, to catch up with what you're seeing in your day-to-day practice. So don't discount that. Now, again, I would never promise a patient, hey, if you do this treatment, this is going to happen, because we just don't know all the factors that are involved there. But these things happen. And that made a huge impact in her life. So that's the why. So in your mind, I would encourage you to really think about, are you in a fixed mindset? Are you in a growth mindset? So here's what this might look like, and a couple things that you might think. If you think, I don't know what this person is going to teach me. I learned all of this in dental hygiene school, and I know what to do. I've been treating patients for 20 years. That might be a sign of a fixed mindset. If you say, you know what, my dental hygienists are never going to change. I have introduced things to them and they are resistant, and I just don't know what to do about it. And I've just given up. I'm just letting them do things the way that they're going to do it. That is a fixed mindset. If you say, you know what, I'm nervous about this. I'm nervous about talking to my patients, but I'm open to hearing because I do think we could do better. That's a growth mindset. Now, you might think, hey, a growth mindset is like, bring it on, bring on this challenge, and let's do this. I'm ready for some change. Most people are not. When it comes to change, most people aren't that enthusiastic about it. So if you're looking at this, if you're looking at, okay, yeah, we need to tighten up our perio protocol. We need to establish something clear and get on the same page. If you're nervous about it, if you're hesitant about it, but you're recognizing that there is a need for this, then you are on the right track. And because you're, when you're nervous and you're hesitant, it means you care about your patients and you care about how you're presenting things and you want to do well. So what I will tell you is, even if you have that door just cracked open, even if your growth mindset isn't a wide open, enthusiastic, let's do this, if you've cracked the door, then guess what? You just need to take that first step through the door. And then when you take that first step through the door, it'll open a little bit more because you'll see some success on the other side of that. Okay. So think about those things that you're saying to yourself or that you hear your team saying, and really see, like, do I have a fixed mindset around this, or do I have a growth mindset around this? And how can I shift even a little bit more to that growth side? And how can I bring my team with me? And I will say one way to do this is to just look at the facts. We talked about data in the last episode, and I believe that data that we shared is very representative of of dentistry in general when it comes to the amount and the prevalence of periodontal treatment in a general practice. I think it's very representative. So we looked at some of those facts on where we are now in the state of all of that. The next step of facts is to really look at, like, what is the definition of periodontal disease and periodontal health? And we'll link this into the show notes. There's an article that I would encourage you to read that came out of the 2017 World Workshop, where the AAP and the EFP, the European Federation of Periodontology, created this new classification. So if you this has been going on since 2017. We're now in 2025. So let's give us a year. Let's say 2018 is when the staging and grading classification system was released. So that's been 7 years. So we've had 7 years to adopt this new classification system. If you're not using that by now, it's time to get on the bandwagon with staging and grading. So I'm going to link you to an article that's part of that really talks about what does it mean to say a patient's healthy. So I would encourage you to look at that. I would encourage you to look at the staging and grading, and then really think about, how am I defining health in our practice? Is everybody considered healthy and they go into a prophy if they don't have, vertical bone loss and 6 millimeter pockets? There's a big leap between health and vertical bone loss and 6 millimeter pockets that's not being identified or treated in a lot of practices. And so that's where I would encourage you to really take a look, because a lot of practices say, yeah, when it's obvious perio, yeah, absolutely, we're getting them into perio treatment. But there's so many patients that are living in that other area. So first, I would say, look at what is the definition from an authoritative source like the American Academy of Periodontology. What is the definition of periodontitis? What is the definition of periodontal health? And then how does that apply to what we're seeing in our practice? And then I would encourage you to take those standards, and we walk you through this in our coaching programs, in our boot camp programs. We walk you through this and hold your hand in detail with this. But you could do this on your own. You can download our standard of care. Let me show you that. I'm going to show you how to get the standard of care if you're on YouTube watching me, but I'm going to walk you through it even if you're just listening. You go to inspiredhygiene.com. And you go to let me just take us back to our homepage. So if you go to our homepage, that's where you'll land. You go to the resource guide and you'll see this drop down. So in the last episode, I talked about the perio percentage calculator tool. The next one on this list is this standard of care worksheet. And so you have a worksheet here, and this is a huge guide to start conversations with your team about, hey, it's time to create this clear standard. It's really time for us to create this consistent perio program in the practice. So first step is establishing your why, shifting your mindset from a fixed mindset to growth, being open to grow, being open to doing things differently, being open to learn and expand your clinical communication with your patients, your clinical diagnostic data collection. How thorough are you collecting that diagnostic data? And then what are you doing with that? And then the next step is putting this into the standard of care worksheet. Okay, so this is where you can get that. You can click on this, share a little bit of information with us, and then we will email you the link to download that standard of care worksheet. You'll be able to access that right away, okay? Okay, so now we're going to look at this worksheet. This is exactly what you're going to be able to download and utilize in your practice. And it's going to walk you through all of these different categories where you need to make some decisions as a team on what you stand for. And so what I would encourage you, dentists, practice leaders, clinical leaders, resist the urge to print this out and take this into your practice and into your office and fill this out, exactly the way that you would have the hygiene team do everything. And then give it to them and say, hey, here's our new standard of care. Resist the urge to do that. You will have much better buy-in from your team, from the hygienist, because they're the ones that are going to be implementing this every day. You're going to have much better buy-in and more success with this if you do this in a collaborative manner. And what I mean by that is, let's say you know that you need to work on your perio protocol. Maybe you've had some meetings about this with the team, and everybody says, hey, we're diagnosing periodontal disease. I don't know what you're talking about, but you're seeing bloody prophies, you're seeing bone loss on the radiographs. It's not being recognized. You're seeing things and you're thinking to yourself, no, we're not really diagnosing it. We're seeing some of these patients, but there's a lot of patients here. Or maybe one hygienist is and the other two are not. And you really want to get everybody on the same page. This is all super common. You are not alone. And this is a great place to start. You can come to your team and say, you know what I'm observing, right? As a doctor, if you're checking 3 hygienists and you're seeing different things come out of each operatory, you have a vantage point that they don't have. And if you are the clinical leader and ultimately responsible for patient care, then it is your responsibility to bring this to the table and say, look, from my vantage point, I'm seeing that we are not all on the same page, and I want to support us in getting there. I want to hear everybody's viewpoints on this. We're going to bring in a credible source, whether you go grab all these AAP papers and you pour through it and you are the credible source and you bring it, you DIY it, that's okay. Whether you utilize our Perio boot camp or you have one of us come in as a coach, we're going to have some sources here, and we're going to really establish a clear, consistent standard of care that we're all going to agree on. And I want to hear your input on this. Like, we're going to put this together. I want to do it together so that we all have a chance to give input. And then you start with the first section. We commit to performing a complete periodontal examination every blank months on adult patients. So how often are you doing that? And then right down here, it says a complete perio evaluation includes recording of the following. So if we're recording pocket depths only every 12 months on every patient, and we look at 20 charts and that's all that's recorded, then we're not fulfilling this diagnostic standard here. Do you get what I'm saying? So if you agree that we're doing a complete perio evaluation or examination, those are interchangeable terms here, every 12 months, that means we've got to be recording all of this information. And that if we're only recording pocket depth, then we're not following the standard of care. But you can't hold your team accountable to something that you don't already have in place. So that's where this comes in handy, right? You really approach the team in a very humble manner. Say, I want to work on this together. You could say, let's start with this one section. Let's just start with our diagnosis and radiographs. And let's just get a clear system in place for that. That alone, when you start implementing that, it's going to reveal a lot. Because if in the past, what you were doing is you were just recording pocket depths, and now all of a sudden you're agreeing to record bleeding and recession, then the perio chart from one time to the next on the same patient, their health could have stayed the same, but that charting is going to look drastically different. You're going to have so much more information. And what that piece alone does is it provides evidence for the hygienist, it provides evidence for the patient, and provides evidence for the doctor that something different needs to be done. Right? If you're seeing signs of, if there's bleeding, if there are signs of attachment loss, recession, pocket depths over a certain level, whatever your threshold is, when you're recording that information and all of a sudden it's there in your face, it's very hard to deny. So I would say take it slow as you're doing the standard of care, even if you just say, hey, let's talk about how often we're doing this complete perio evaluation. What do we need? What support hygiene team do you need to be able to do this consistently, right? And you might change this. You might say, we're going to do that every single time this patient comes in for a hygiene visit. This example says for patients in perio maintenance, we will perform and record a complete perio evaluation every blank months. Some teams, they want to do it for every patient once a year, right? And again, recording all of this. Maybe they do that once a year. And on the alternates, they do what we call a periodic perio evaluation, where they record pocket depths and bleeding. So you get to decide. This is your practice. But this is your opportunity to create these clear standards. And when you do this, you are not only investing in your hygienist and their work, you're investing in your practice. Having clear systems like this builds value in your practice. Because if you have new team members that come in, you direct them to your standard of care. When you have new associates come in, you direct them to your standard of care. This is how we operate with periodontal disease in our practice. So I would encourage you, really self-evaluate your mindset. Where are you with that? Download the standard of care and just work through a few of these. Work through a few of these. Where are we now? Where do we want to be? And even if you took one of these at your monthly team meeting, at the end of 6 months, you're going to have a full out standard of care. We work through this in a few hours with our clients because they've had this foundational learning and coaching that leads up to this, and they can make decisions because they've seen the evidence, right? They've seen the research and the references and all the sources that back up a proactive hygiene standard of care. And so they can fill this out pretty quickly and collaborate as a team. But I'm just going to scroll through this so you can kind of see what's here, those of you that are watching on YouTube. But the different sections for those of you listening on this hygiene standard of care are hygiene diagnosis. How often are you doing that complete perio evaluation? Radiographs. What radiographs are you taking? What types of radiographs? Medical history update. How frequently are you doing a complete written signed medical history by the patient? Periodontal disease. What are your thresholds? You look at the AAP standards, and then you can create your own philosophy based on that of when you feel like it is appropriate for a patient to move from periodontal maintenance back into active therapy, for example. You get to decide. This is your standard of care. And from the standard of care, you're going to be able to create your periodontal program. This is the basis of this. And so just encourage you to go check that out. We'll put the links in the show notes, and I'll share a little bit more on the upcoming episodes here in season 2 about the number 1 most common missed opportunity in hygiene. Stay inspired. Thanks, everyone. Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com. And as always, stay inspired.